Hello, everyone, and welcome to today's webinar. I have a few announcements before we get started. If you need technical assistance during today's event, please type your questions into the questions box, which is located to the right of the slides window, and click the submit button. You can use the same box to submit questions to our speakers anytime, and if we don't get to all your questions today, we will try and follow up with you offline. The questions box has multiple tabs. You can view any webinar handouts if available, as well as the abstract, speaker information, and access your certificate of completion. Finally, you'll receive an email by the end of the day with a link to a replay of this webinar as it becomes available. So with that, I'll hand things over to Sean to begin the presentation.
Bridget, thank you very much and welcome everybody. So as you can see on the title slide, today's discussion is lessons from the pandemic. And it's specifically some of the experiences that we've all had in our worlds of supporting the transformation of care delivery and patient experience. So my name is Sean Hogan. I'm general manager at Innovaccer. We're a health tech analytics and data company, and we are supporting the work that our story will be about today. And I'd much rather have you hear about what we do through their story than to have me speak to it. So we're going to jump right in. So if you page down, I'll introduce the real stars of today's story. So we have with us Julie Smith. So Julie is with Banner Health, where she's the VP of Enterprise Data Management. And in that role, she is at the absolute epicenter of all things that Banner has been doing with respect to data, but specifically to how they're applying it to their digital transformation agenda and using it in the way that they engage with their patients in a very different way. So Julie's going to share the story of what Banner's been doing through the pandemic and some of the work that they've been doing to deliver on their goals and objectives as a system. And then also with us is Rakesh Matthew. He's Director of Interoperability for Payers and Providers at Sogeti. And Rakesh has been a right hand to Julie, a partner in crime, so to speak, with her and with us, as we've been working together to deploy some of these solutions and services. And then there's me, Sean Hogan, with Innovaccer. So if you page down for us. So I think all of us are familiar with the changes that are playing out around us. And certainly much of that is driven by a change in the expectations of those who we serve. So there's this concept and notion of consumerism, and where patients are taking the kinds of expectations that they have in other industries and bringing it to healthcare. We know that there's a top line pressure to grow, and we've seen some of how the changes in the realities of care delivery has had an economic implication to our systems. And certainly the way that we're engaging with those that we serve in the overall experience is becoming increasingly virtual. The statistic that you see here on 250 billion comes directly from a McKinsey study. And what we're seeing as we're now in a different stage of how things are playing out, that relative to prior to the pandemic, the use of virtual delivery services is about 30 to 40 times what they were prior to the pandemic. And I think most of us would also agree that it's not so much about just we can deliver a care experience virtually. How are we really making it a differentiated experience that brings to it a level of engagement that really involves a person in their health and gets us all to different kinds of outcomes? As we go into the discussion, I want you all to think about some of where we were as the pandemic was first unfolding in the spring of 2020. We were all dealing with information that was constantly changing. We were getting a new perception on how real it was, how fast it was evolving, and dealing with the implications. And throughout all of that, there was a real urgency or pressure for accurate data, timely data, and data that as we made decisions could stay with us to inform the implications of the choices that we made. So just as we get into the discussion, we can all reflect on the way the world has changed around us today and what we're dealing with in the current realities. Remember the reality that we were faced with on how rapidly things were changing, how much uncertainty there was, and the imperative to be able to act quickly. Page down for us, please, one more. At the core of that, of course, is that in all of these experiences, whether it was before the pandemic, during the pandemic, and now the world that we're in today, the notion of a patient and their journey, understanding them as a person, a whole person as an individual, has a different set of needs that are unique to their circumstances. And as that journey plays out, there are different circumstances along the way in that continuum. And we know that this is a constantly iterating cycle. And so for us to be able to handle those individuals in a complete and thorough way, the notion of unified information has become increasingly important. And really, in many ways, that's at the core of the story that we want to share today. So with that, let me page down, please. And so, Julie, tell us about you some more. Tell us about Banner, and then we can jump right into some of the awesome things that you're doing.
Thank you, Sean. Rakesh, nice to be with you today. So a little bit about Banner. We do have Banner is an integrated SIN. We support 1.35 million patients on the insurance division side. And then we have both affiliated physician practices as well as employed physicians. We have about 30 plus hospital systems and 400 clinics in our local areas of Arizona and Colorado, Wyoming, Nebraska, in California. So pretty big system, lots going on, lots of data. So my responsibility is enterprise data management. And like you were saying, when we started to see the COVID numbers rise, everybody went very quickly to where's the data, where's it located, and how can we get it in a viewable fashion so that everybody at Banner can see, what's going on in all of our locations. So page down. So as you can see, very quickly from February to April, when we started seeing the just tremendous increase of folks being in our Banner hospitals and in our urgent cares and in our clinics, we had to, as a team, I have about 100 people that work for me just in reporting and analytics across Banner. And what we realized is our current EDW just didn't support real-time data, and it didn't support getting data culminated in a fashion that we could present in a quick manner. So we were lucky enough to have just signed a contract with Innovaccer, and we kind of leaned into Innovaccer and asked for them to help us. So we located the sources of those data elements, and we were able to use the Innovaccer engine to quickly consolidate the data elements and unify the data elements so that we had a unified view of what was going on at Banner. And so we had about 16 to 20 sources that we needed to unify very quickly to see where we were from supplies to locations to COVID patients to transport. And so we used their platform to be able to do that. So page down, please. Right, so as you can see here, we were able to take our internal dashboards and quickly put up a page on the Innovaccer platform. We are using Power BI here, and we were able to take each of the different elements here, and as you can see, just having knowing the daily bed supply and the lab testing and the medication and the supplies became very important to those of us as we were moving patients around and trying to figure out where patients were and what supplies were needed, as well as staffing and medication. So we were able to put about 32 dashboards up on the Innovaccer platform, and not only did they help us put the data up, they also helped us with a vision and a strategic view of those elements on the dashboards. So next page, please.
And Julie, if I just, as you're putting up those dashboards, it's not like you didn't have them before, because you were all looking at some of those things. I think if I remember right, part of the challenge was the ability to see it with a sufficient timeliness because
Yeah.
of some of the urgency that you are dealing with.
Yeah, that's right. That's right. We started putting together dashboards on another platform, and we realized that our current EDW just didn't have the ability to send data real time. And so we were using the flat file approach and using the FTP side and trying to bring in data. And so we were really only able to see how we were doing in operations about every 48 hours when we started. So you're correct. A lot, the data was in disparate places. We had Excel spreadsheets, as well as 15 different systems tracking, beds and people and transport. And so, yes, so that's a very good point. And we quickly realized that knowing something every 48 hours as quickly as the pandemic was moving, it just wasn't enough for us. And so moving to the Innovaccer platform and being able to work with your company on bringing the data in and stratifying that data helped us move from every 48 hours to once per day and then down to every hour. So by the time we were into the July, August timeframe, we had an update on those dashboards every hour by using the Innovaccer platform.
Yeah, it's great stuff.
So a couple of other things. What's interesting is we not only use the dashboards for internal operations. We were also began putting up vaccine sites. So we put up 13 vaccine sites around the state of Arizona and Colorado, and we used the platform to put up locations of the shots, what shots were available, who the manufacturer was, and we were also able to drive traffic to those sites and see in an hourly basis how many people had gone through our vaccine clinics for both our first vaccine and our second vaccine. So the platform is paid off in a number of ways, and I will be able to show you some additional views of what we use the platform today. Next slide. Yeah, so when we started this, our goal to use the Innovaccer platform was 360 visibility from all of our locations. So we wanted to drive all of our operations folks and our executives to one location every day to see the state of the union, if you will, at Banner. And so we were able to culminate all of that information in a daily view and an hourly view, as well as interact with our current Teams environment. So that was very important to us. So we were able to use Teams. Innovaccer worked with us. They are a partner with Microsoft. And so Microsoft and Innovaccer got together, and we were able to reuse not only the Banner environment, but the Innovaccer Teams environment. And so we used that single sign-on pretty efficiently and got everybody up and onto the platform. We also were able to see as I mentioned, the acute facilities and our testing facilities up on one view from an operational executive perspective. Next slide, please. Yeah, so these are, this is kind of our pride and joy here. This is just some examples of the dashboards that we were able to build on the Innovaccer platform. I think the bottom dashboard with the pink dashboard, we call it our fishbone dashboard. And what it tells us is every time the pink line begins to cross the orange line, we knew that a peak was coming again. So we sort of tracked it from the beginning of COVID to still today. And we can see even today's date, we can see the bottom line, which is COVID positive, creeping up, and that it's going to pass the orange line pretty soon in some of our states. And so we know now that we need to be prepared and have our hospitals prepared and have our urgent cares prepared and vaccine locations. So it's been a very effective tool on helping us prepare going forward. So we've been using this tool now. It's funny, we crossed over a year in April. And so we've been up on the platform about 15 months. And so it has lots of, good indicators for us for our business and operations. And then in the top right-hand corner, you can't see it very well, but that's our daily dashboard of all locations inpatient, outpatient, ventilation, discharge and transfer. So that's that one-stop shopping that all of our executives use every day. And then the other top left-hand corner is our supply chart. So it gives a supply for every location for all of the Banner supplies, including ventilators and gloves and masks and, you know, all of the important things that are needed to care for our patients. And quality went live on June 30th of this year. So not only were we working very hard on the pandemic, we also had a different team working very hard on the population health management. So all of the assets that we were able to gather during the COVID pandemic, as well as additional tables, we have the Cerner EMR here, and we also have 250 affiliated physician practices where we're able to use the Innovaccer products and bring in information to the platform. So this is an example. We took out the numbers because, you know, obviously those are Banner proprietary, but we just wanted you to see the value of the dashboards and how we can look at our risk management and stratify our patients a little easier with the advent of using this platform. So
could
next,
you just,
please.
I think what you
Sure.
mentioned, you know, the EMR and your use, Banner is a very advanced user of Cerner, and
Yes.
it's a central part of your total enterprise strategy. And so
It is, yeah.
one of the questions that often comes up is, well, how does this complement and augment what it is that you do within the Cerner world, and maybe specifically around some of how you're thinking about a population and connecting with your networks?
Yeah, so being an integrated SIN here, we have our insurance division, we have our own insurance products, and we have both employed physicians and affiliated physician practices. So we have to provide data and information for risk and cost and quality across the Banner enterprise. So we use the Innovaccer Health Cloud here at Banner, and because of that, we're able to use the same visuals, but display the data based on the audience that's looking at the data. So we can build risk PM for the insurance division side of the house, and we can also build those dashboards for the provider side of the house. So what we've done is basically said, hey, here at Banner, for population health management and for being able to produce those dashboards that go to our executives and our board members, we're going to use the Innovaccer platform and take in the Cerner data, the HIE data, the MS4 data, all of the different systems. We have about 47 sources of data now up on the platform. So we're able to see one view for across the Banner enterprise because we're using that unified data model from the Innovaccer Health Cloud. And again, this is another picture of the dashboard. Again, we've removed the actual numbers, but you know, this is a real dashboard we use, and so we have HCCs, we have ED per K and per member per month, and so we're trending. We've begun trending, so we've loaded 3 years of data, 3.5 years of data now, and so we've begun to trend that information, and our care teams are using it very effectively. So. When we purchased the Innovaccer application, we purchased InNote, which is kind of the bot, if you will, that appears in the physician offices when a member or patient comes in, depending upon where you are, and says, "Hey, I know who Julie Smith is. Let me give you a little background on Julie Smith." And we also use InGraph, which is the analytics product. and we use Patient 360 and In Care. So our care management folks and our care navigators have a view of that patient, a holistic view of that patient. And it, again, I think the neatest thing about Innovaccer is it brings in one view. We call it Patient 360. It brings in one view of that patient across the Banner enterprise. So any labs or scans that they've had done, or encounters or visits or results, I can pull up that Patient 360 and care for that patient. We call our patient Sophia's, and care for that patient or that member holistically, no matter where that patient is seen within the Banner enterprise. This is kind of neat. So we have 259 affiliate physician practices. They have all kinds of different EMRs, you name it, we probably have it here. So they are non-Cerner EMRs, and we use our EndNote product to allow those our affiliated physicians to know when a Banner patient or member is in the clinic, and they have a covered life. And so this is actually our install base of folks using the EndNote application out in the field, and we can keep track of who's using it, how they're using it, and how many gaps in care that they've closed. So this is an exciting view for us here at Banner to see how our affiliated physician practices are doing. So next slide, please. And so my counterpart, Bryce Carter, we quickly learned that telehealth was the easiest mode to take care of our patients, obviously, during the pandemic. And then as the pandemic has lulled a little bit, what we discovered is our patients really still like to use telehealth. So we have 3 different telehealth products here today. And so we've been able to take that data from those telehealth products. We have 2 telehealth vendors, as well as a vendor that uses our insurance division and covers our insurance division members and providers, and bring that data into the platform. So that also integrates into our Patient 360 view. So like we like to say, making healthcare easier so life can be better. And so that has driven, a tremendous amount of insight into our patients and insight for our caregivers, for our Sophias. Next slide, please. And so we're so excited. The kind of last module we're deploying right now is called In Care. And In Care is used by our care managers, as well as I would say our entire care team. Our entire care team would be able to log into EndNote and In Care and take a look at the patient and use Patient 360 to see how we've engaged with our patients, how our patients are doing, et cetera. So we will continue to use this product for outreach and engagement. And I know Rakesh has some information on that coming up. So more to come on outreach. So this is kind of our journey and what we've achieved so far. So we're seeing about $4 million year over year change in savings across the board. Our goal is $15 million. So Sean, more to come from Innovaccer, I hope, on these terrific products. And we are looking at a 70% reduction in infrastructure costs. We have a SaaS model and a PaaS model. We run both of our insurance division side of the house on Innovaccer platform using AWS, and we run our delivery side of the house on the Innovaccer platform using Azure. So not only do you bring a new platform to us, but you also bring diversification, because we have many applications here at Banner. And so being able to choose our platform of choice and move the data quickly onto the 2 different platforms depending on the need has been super helpful to us. And again, we see well over 1 million patients every year, and we can say that we have that 360 view of our Sophias.
Awesome.
Hey, thank you, Julie and Sean. So I just want to do a quick intro. Rakesh Matthew, Director for both payer and provider side, focusing on interoperability and innovation. So I'm focused heavily on the connected health side, and I wanted to give a little bit of a shout out to Julie and the partnership that Sujeti Capgemini has had with Banner for the last few years. And in the last year with the pandemic, I think this relationship has gotten much stronger, and our working relationship with Innovaccer has also gotten better over the last 1 year. And I would say the work that was done, the work that Julie went over in the last 15 to 20 minutes, if it was in a normal circumstance, I would say that kind of implementation and that kind of rollout would have taken multiple years. And what Banner team has achieved with Innovaccer and Sujeti in a matter of 12 months is unparalleled. And I think the benefits of that rollout, we are seeing it right now with the new the spike in the number of COVID cases and the fact that the team is able to manage everything without a hiccup. And of course, all rollouts have its own challenges. In the middle of all this, we also went live with the CMS interoperability FHIR APIs with Innovaccer's interoperability module, which was again a CMS mandate. It came on the same date, 6/30, as when the other dashboards went live. So having 3-4 different parallel threads of work happening across the organization, trying to consolidate all the data was a tremendous effort. And I have to commend everybody who was involved in this, starting from the data analysts all the way up to the architects and the leadership who rallied around it and made it possible. So I get to talk about something interesting, a little bit, futuristic, and part of what I have done in my previous life was actually build the first marketplace for innovation for HIEs, health information exchanges. Now, most of these organizations, most of the payer provider organizations are building their own marketplaces. And with the Innovaccer platform, I think Banner is positioned well to actually start thinking about creating a platform for innovation. So if you move to the next slide. So during Julie's presentation, she talked about the persona that Banner has, Sophia. So you can see Sophia right in the middle of this picture, and you can see that all the data feeds, all the data sources, whether it is claims data from a payer or whether it's EHR data, lab data, pharmacy data, all are in the Innovaccer platform. You can see that at the bottom. And if you think about it, just like in the picture, that all the different applications that could potentially support a patient would revolve around the patient and have the patient right in the middle of it. This is exactly what a platform for innovation would look like. A platform that could support multiple applications, whether it is a connected health application, a clinical application, population health management, or even social determinants of health. It is critical to have this because at the end of the day, a happy patient is a patient who's going to come back to the hospital and have return business. Revenue is directly related to how satisfied a patient is going to be. So if you move to the next slide. So this was actually a study that was recently conducted by one of our peer organizations, Accenture, for a $5 billion health system. They have almost 900 million, that's almost 1/5 of that revenue at stake if they have poor customer experience. And it can be costly over time because as organizations are moving away from fee-for-service and moving into value-based contracts, it's important to have that customer experience or the patient experience so that they keep coming back. They're tied to the organizations that are taking care of them, and the providers and the payers give them the unique experience that they cannot get anywhere else. So Banner has been focused on trying to create a new patient experience for Sophia, a Banner experience. And it is tied to the 4 actions that are on this slide. It's have a personalized message whenever possible. Have virtual care options, as Julie mentioned. There are at least 3 different options right now that Banner patients have when it comes to virtual care or telemedicine. Meet them at the front door and listen through social channels. It's very important to have a social media presence and to take that social media data and make it actionable. It's something that we take it for granted. When you actually go to Amazon, you go shopping and you get on Amazon, the first thing that you see is everything that you have shopped and then some recommendations based on your previous shopping experience. Behind the scenes, there's a lot of AI machine learning that happens where the data is used to figure out what exactly would a customer want to buy. When it comes to healthcare, we're not there yet, but what Banner's vision is around that, if you could move to the next slide, is to start looking at AI and start looking at how the data that we have aggregated through the Innovaccer platform can be used for additional value-added services where we can actually have service directed to the patients and recommendations to the patients based on their conditions. So imagine a scenario where I am logging into my member portal or patient portal. Again, this is going to be a unified vision of whether you are an insurance member or a patient of the health system, you would have the same exact experience. So as Sophia, if I log into the portal, my experience will be customized for me based on my history, my clinical history, my social determinants of health, my information that I would provide to my provider based on how I feel about the treatment that I receive. So all these different aspects are looked at. So this picture that you see right now is more of a patient engagement workflow where you are actually taking a continuous feedback loop by taking some of the patient engagement activities, taking the surveys back to the learning of the machine learning system and allowing AI to give specific, customized, personalized feedback to Sophia. If you move to the next picture, this is more of a data-based view of what we talked about in the previous slide. So you can see within the Innovaccer platform on the left, you can see what kind of data we are looking at. We are looking at EHR data, we are looking at claims data, we're looking at remote patient monitoring data, social determinants of data, genetic and patient reported data. All of this is used to create that behavioral model that is actually fed back as nudges to Sophia. So it's not about trying to indentate the patient with lots of notifications, but to be very structured in how you are actually providing those suggestions. Hey, Sophia, it has been over 1 year since you did your last colonoscopy or your mammogram. Would you like us to schedule an appointment for you to visit your primary care physician? Rather than Sophia going in and figuring out how to do the appointment, where to click on, the system is going to actually allow her to just say yes, and then based on the availability, based on convenience, and of course, there are going to be other aspects of this, like checking based on her social determinants of health. If she is in an area where transportation is an issue, one of the suggestions could be, do you need a ride? Banner has relationship with multiple transportation networks, and that's another way in which Sophia can be incentivized to come back and see the physician. And again, this keeps the patient within the 4 walls of the payer and the provider and not go to other providers. Of course, leakage is a big issue with all providers and payers at this point. They want to try and keep the members and patients within a close network and to make sure that they are taking care of themselves, they are doing their scheduled visits and their tests. And as Julie mentioned, this is an opportunity to close all gaps when they actually go back to the doctor's office. So this is the vision of Banner when it comes to how Banner is going to be looking at Sophia, the persona in future.
Rakesh, thank you. That's fabulous. And I I love some of your comments in terms of just how so much of this anchors off of the end vision that Julie and the Banner team have been pursuing. And yeah, they press us hard all about delivering better care, deliver better experience for the members, the communities, the patients they're serving. So it's been fun to work together to make a difference. There have been some questions that have come in, and just along that lines of the experience, you know, one of the things that we're all dealing with in healthcare is how technology, how much does it help the caregiver? So when we think about the quadruple aim, the support to caregivers is a critical part of the story. And Julie, you alluded to this in your comments. And I wonder if you could just share more, because getting the adoption and use to be seamless, effective, and a good experience, not only for the patient, but also for the caregivers. How has that played out?
Yeah, we were a little nervous about it at first, and it's funny. We rolled out. It seems like we rolled out the first 24 offices on EndNote, and I can tell you it was interestingly immediate provider adoption. The little bot comes in, and you see the Innovaccer logo pop up, and they know to click on it, and it gives them right in the same screen as they're talking to the patient. Hey, I see you went to an urgent care. Hey, I see that you need to get your A1C, that you haven't gotten your A1C quarterly as recommended. And then, they can also re-evidence the HCCs that folks have every year. And so it's been a really interesting and a very positive experience for the providers. And we have about a little over 1,200 providers up on the platform today, as well as we're starting on our delivery side of the house to have, so they can have that same experience. So for us, it's been a pretty easy adoption, a pretty easy implementation. It's so far so good, and we appreciate the help of Innovaccer to get it out there and get the communication and the training out there to our providers.
Yeah, Julie, you've been clear from the outset that if it doesn't deliver for the teams who have to use it, it's just not going to matter. So
that's right.
We've worked hard to make that work.
That's true. It's been a great partnership.
And another, question that's come in, the audience has picked up on the fact that Banner, of course, is both a care delivery system and a payer too. So
right.
They carry risk. And I'd be interested if you could share how that's impacted your perspective, Julie and Rakesh. I know you work with a number of systems, so maybe you could both comment on that question.
Yeah, so for Banner, yes, we do. We have a clinically integrated network here. So we have the insurance division, and we also have our own products. And so one of the things we were trying to do was make sure that from an enterprise perspective, we showed the enterprise risk, right? So when we go to our executives and go to our board meeting, we have that enterprise view of risk. And so we've been able to take one presentation to the board meetings that say, this is Banner's overall risk, and this is how we intend to, work together to reduce that risk, as well as how we might coordinate care a little better between the two entities, because it's having the right hand and the left hand both seeing what each other is doing. It's been a really nice collaborative experience. We do have a PCP group, a steering committee today that's made up of both sides of the house. So that's been a change for us, and it's really opened the doors, I think, for collaboration as well as planning and strategy, which we didn't have before.
Yeah, just to add to that, Julie and Sean, the fact that Banner is a payer provider under the same roof makes it extremely beneficial when you compare with other payers out there who are struggling to get the attention of their provider counterpart. And when you talk about risk-based contracts, the Banner is in a very unique position to take on additional risk because they control the care delivery, right? And that also allows not only with the BUHP side, which is the which is the owned insurance company, but Banner can also make great contracts with other insurance payers, both commercial or government programs, because of the extended care delivery network they have. And I think when you compare it to others, right, as Sean, you were asking this question, I do see this advantage, whether it is Kaiser or UPMC, Geisinger. Definitely, this is a great advantage. Right on the East Coast, Jefferson is just getting into that same space where they are in the process of becoming a payer provider. I can definitely see that is a trend. Payers are going to get into closer relationships with providers, because otherwise risk-based contracts are not easy to implement and really make it profitable. And pay for service contracts are going to slowly change over to pay for performance and value-based contracts. You can't count the pay for service out of the equation yet. It is still going to be there, but over time, it is definitely going to change.
Yeah, for sure. One thing we can all count on is things will continue to change. So, on that note, share with the group some of the things that you both are either see as some of the big challenges ahead, or has you most excited? I know enough about both of you that you tend to see challenges as opportunities, but what has you looking to lean in, and what's ahead?
Yeah, I think for us, we've seen the power of the tool and the power of unifying data, and so we have about 31 lines of business where we have an opportunity to take that data and move it onto the Banner Unified Data Model, and have not only clean but validated data and clean sources, and kind of one place to go from the Banner enterprise. So when the executives need a report or they need a dashboard, there's going to be one location for them to go, and hopefully they won't have to make 25 phone calls to get that dashboard or get that report going forward. So that's our opportunity that's directly in front of us for about the next 22 months.
Great. Would care to add anything to that, Rakesh?
Yeah, I'm because I'm involved in a lot of interoperability related activities. I would say is that if the government could be more clear on regulation and not change them or keep them consistent, that would be great. And I think that's one of the biggest challenges when you talk about data sharing between organizations, having standards and being able to share data. FHIR is great, but within FHIR, there are so many different variations of implementation guides and versions of that. And we need to stick with something and need to be consistent. And CMS need to come out with very clear guidelines on how peer-to-peer data exchange needs to happen, because that's the next big thing that's going to happen in the next 6 months. And from an organization like Banner, this is going to be great, because when new members come in, we can bring the data with them. But if the pair, the other pair is not going to give the data in a standard format like FHIR, because CMS has not mandated that yet, we're hopeful that the new regulation is going to come out in the next few months. But I look at that as being, great challenge, things that if it is done right, we would definitely benefit as an organization.
Well, we'll be sure to get the message into the administration that Rakesh says, get on with interoperability.
That's right.
I think the train's left the station. There's really no looking back. And it is great to see so many of our customers who are just embracing this as something that is the direction we all need to go. But let's keep the pressure up. I'll ask a final question, which, both of you, listening to the story, it all sounds awesome and seamless. And I'm sure there's some other aspects of it too that we all live through. What would be your advice for some others? What have you learned through the work that we've been doing together that you might offer to others that are likely facing some similar challenges, have some similar goals and aspirations, and that you would say, if I'd known this, this is a lesson learned that I wish I'd known or would love to share with others.
So I would say our biggest lesson learned was there's a sheer amount of data that is repetitive across the organization. It's the same data sets over and over and over again, as well as data governance. So we've taken the opportunity to really do a holistic view of all of our data by line of business, and collect those data elements and deploy a governance tool and build a steering committee around governance where we have data stewards and people actually looking at the data. And when we bring on a new application today, it goes through a different kind of onboarding. And so, do we have a similar application today? Do we have similar data sets today? And so we're starting to look at our future, I think, more strategically than we used to. We used to buy a lot of one-off vendors, thinking that they had something solved that we didn't have here at Banner. But I think what we've learned is a lot of what we've seen from the consolidation and collaboration is we have a better view into our future of what we purchase and what we use throughout Banner.
Thanks,
Well,
Julie. Rakesh, how about you?
I think, Julie, you said it right. Data governance, having that baseline is critical for implementing anything like this. And I would just say that, looking at all the dashboards, looking at everything that we talked about today, it may look very easy, but it is not easy. That journey is painful, and you need to be ready to go through that journey and work with the vendors to make sure that that the goals are set in such a way that it is achievable.
Yes.
And again, kudos to all teams involved in this journey. I think it has been a fabulous journey so far, and I think we're going to continue doing great things at Banner.
Absolutely.
Oh, I expect nothing less. Well, I'd add to that: pick good partners, pick good customers, and just keep at it. And the progress is exciting and all worth it. Well, this has been a great discussion. As always, when I interact with Julie and Rakesh, I'm always learning something. So I'd like to say thank you to you both. And I will hand back to our sponsor, HIMSS, and Bridget to wrap things up.
All right, thank you so much. I just have two reminders before we go today. A survey will pop up on your screen at the end of today's event for all the viewers. So if you could just take that and share your thoughts with us, we would really appreciate it. And finally, another reminder that today's session will be available on demand through the HIMSS Learning Center. So feel free to come back, watch it anytime, and share with your colleagues as well. Thanks, everyone. Have a great rest of your day.
Thank you.
Thank you. Take care.